All right, everybody, welcome back. It's time for another deep dive.
Yes, it is.
And today, we're going to be diving deep into
Medicare.
maximizing your Medicare benefits in 2025.
Yes.
And we've got a really fantastic newsletter that we're going to be pulling from today.
Good beer.
From Buckalew Financial Services.
And it's a great newsletter.
Yeah, and they're really focused on helping people.
All about Medicare.
Yeah, maximize their Medicare benefits.
Absolutely.
So think of us as your guides.
Yes.
As we go through this newsletter and pull out these insider tips, these kind of
the important things to know.
Yeah, these essential things to know to make sure that you're getting the most
absolutely
out of your Medicare benefits in 2025.
Yeah, absolutely.
So let's do
it.
Let's jump right in.
Yeah.
One of the things that I thought was really interesting that they start off with is this idea of preventive care.
Right. Preventive care is so important.
It is.
Because, you know, a lot of people think of Medicare only when they're sick.
When they're using it.
Right, or they need to use it. And it's like, no.
Right.
Medicare can actually help you prevent getting sick.
And they're covering
a
lot of this stuff.
Yes, they are.
For free.
Absolutely.
So you can get like a free
stuff.
Health checkup bonanza.
Yes.
Like every year.
Exactly. So what kind of things are we talking about?
Well, you know, annual wellness visits,
okay,
cancer screenings,
right,
diabetes screenings, heart disease screenings, all this stuff that can really, you know, if you catch it early,
absolutely
make a huge difference.
Early detection is key.
And I think, you know, they emphasize this in the newsletter.
Yeah.
That it's not just about catching it early.
Right.
But it's actually taking a more proactive approach.
Exactly. Rather than being reactive to something that happens, you're being proactive to prevent things from happening.
Yes, and I think it's really great advice.
Yeah.
They also mentioned that it's really smart to schedule that annual wellness visit early in the year.
That's a good tip.
Like, why is that?
Well, think about it. You know, if everybody waits until the end of the year to try to get in for their annual physical or wellness visit,
it's going to booked up.
It's going to be really tough to get an appointment.
Yeah, that's a good point.
And, you know, you're kind of rushing it at the end of the year. So get it done early in the year. Yeah. Gives you a baseline for the year. And then if there are any issues that come up, you have plenty of time to address them.
You got the whole year.
You got it.
So it's really about, you know, it seems like it's really about just like taking control of your health.
Yes. Taking ownership of your own health and well-being.
Okay. So that's preventive care.
That's free.
Love the free stuff.
Yeah. Now let's move on to...
What else we got? This is one of my favorite parts of the newsletter.
Oh, yeah.
Hidden gem benefits.
Hidden gems, yes. So
what are they talking about here?
These are benefits that a lot of people don't even know exist.
That's right. They're kind of buried in the fine print of your plan.
And they vary from plan to plan.
Yeah, very important to understand that your plan may have different hidden gems than somebody else's plan.
So you really have to kind of dig in and figure out what your plan offers.
That's right.
But just to give you an idea of what kind of things they're talking about.
Okay.
They mentioned that some plans cover fitness programs.
Yes.
Yeah.
Now, that's a great benefit.
Yeah.
Because, you know, staying active is so important.
It is.
For our physical health and our mental health.
Right.
And a lot of these programs aren't just about going to the gym and, you know, working out.
Yeah.
They offer a lot of social opportunities.
Right.
So you can actually...
Community build, meet people.
Yeah.
Make new friends.
Yeah, it's interesting. They actually highlight a study in the newsletter that shows that people who participate in these fitness programs, like Silver Sneakers, which is one that they mentioned, reported a 44% increase.
Wow, that's a lot.
In social connections.
That's amazing.
So that leads to...
So it's good for the body and the soul.
Improved mental and emotional well-being.
That's right.
Which is really interesting, I think.
Yeah, really important.
It's not just about the physical health benefits.
Exactly.
It's about the...
holistic well-being.
The holistic approach.
That's right.
And then they also mentioned that some plans cover dental, vision, and hearing.
Yeah, that's another one that's often overlooked. Yeah. You know, people think, well, Medicare doesn't cover dental, vision, and hearing. But actually...
some plans do.
Some plans do.
Yeah.
And it's really important to understand what your plan offers.
Right.
Because, you know, those things are critical to our overall well-being.
They are.
Well, especially as we age.
Especially as we age. That's right.
Yeah.
Taking care of our teeth, our eyes, our hearing.
Absolutely.
Super important.
And then
what else did they mention here?
This was a big one for me, too.
Oh, yeah?
Some plans actually have allowances.
Yes.
For over-the-counter medications.
Yeah, like free money.
It is.
To spend on the things you need.
Yeah.
So you're going to the pharmacy anyway.
Right.
Might as well get some free stuff while you're there.
Yeah, they basically give you like a debit card.
Like a debit card.
That you can use.
That's right.
To buy certain over-the-counter medications.
Exactly.
So definitely, like you were saying before.
Yeah.
Every plan is different.
Every plan is different.
So you really have to look into your specific plan.
That's right.
And, Buckalew Financial Services.
They can help?
Yeah, they're experts in this.
Absolutely.
They can help you understand exactly what your plan covers.
You can give them a call.
Okay, so
what else we got?
Let's move on.
All right, let's talk about prescription costs.
Prescription drugs.
Because that's a big concern.
Yeah, and I think this is something that everybody's
for a lot of people
thinking about.
Yeah.
And I think the newsletter really gives some good advice here, really practical advice.
Yeah.
About how to save money on prescription drugs.
Practical steps you can take.
Yeah, and the first one is so simple.
Oh, yeah, what's that?
Talk to your doctor.
Talk to your doctor.
About generic alternatives.
Generic medications.
Yeah.
They often work just as well as the brand name drugs.
Right, and they cost a lot less.
Save you a lot of money.
So
simple conversation with your doctor.
Yeah.
Save you a lot of money.
They also talk about using preferred pharmacies.
Oh, yes.
I'll admit.
Preferred pharmacies.
I don't totally understand how that works.
So basically the insurance plans, they negotiate lower prices with certain pharmacies.
Oh. So if you fill your prescriptions at one of those preferred pharmacies, you're going to get a lower copay.
It's like they have a special deal.
Exactly.
With those pharmacies.
It's like a special deal.
Okay.
Save you some money.
All right. And then for those who need extra help with prescription costs.
There's a program for that.
There's a program called the Extra Help Program.
The Extra Help Program, that's right.
And so this program is designed for people who have limited income and resources.
It can really help people afford their medications.
Yeah, and they really encourage everyone to check their eligibility.
Don't assume you don't qualify.
Yeah.
You might be surprised.
Because a lot of people qualify.
That's right.
And don't even know it.
And they're leaving money on the table.
Okay, so we've talked about preventive care.
Yes.
Hidden gem benefits.
Those are good.
Prescription costs.
Important stuff.
Now let's talk about what's changing in 2025.
Things are always changing.
Well, we all know.
Right.
Things change all the time.
Medicare is no exception.
And Medicare is not immune to that.
That's right.
So what are some things that people should be aware of going into 2025?
Your plan may change from year to year, so premiums might go up. Deductibles could change.
Right.
The medications that are covered might change.
Oh, wow.
Even the doctors in your network could change.
So it's really important to stay informed.
Stay informed, absolutely.
About all these changes.
Because if you don't, you could end up paying more.
Or not having access to the care that you need.
Or not having access to the doctors that you want to see. So it's really important to...
So how do we stay on top of all that?
Well...
Because... it's a lot.
It is a lot.
To keep track of.
It is. That's where resources like Buckalew Financial Services can be so helpful.
So they can kind of help us navigate all that.
They can break it all down for you.
Okay.
Explain what the changes mean.
Right. Help you choose a plan.
Okay.
That's right.
For you.
So now that we're talking about all this stuff, I have a little tip.
Okay.
And this is from someone who hates paperwork.
I hear you.
Keep your medical records organized.
That's a great tip.
It is.
Because it can save you so much hassle down the road.
I mean,
imagine.
You need to dispute a claim.
And you can't find the paperwork.
Or if you're trying to understand like how much you spend on health care.
Just knowing where everything is can save you so much stress.
It's just good to have everything.
Absolutely.
Organized and accessible.
And they even give some tips in the newsletter about how to do that.
Like what?
They recommend keeping a file. Or even using an app.
There's some great apps out there.
To track all your medical visits, your prescription information.
Keep track of everything. Your explanation of benefits statements.
Your EOBs.
Yeah, the EOBs.
All right.
And receipts for any out-of-pocket costs.
Keep all that stuff.
It might seem like a chore.
Yeah.
But it can really pay off.
In the long run.
So to wrap up.
Yes.
What have we learned today?
A lot of good information.
Being proactive is key.
That's right.
when it comes to your Medicare benefits.
Take charge of your health.
Take advantage of those free preventative services.
Free stuff.
Dig into your plan to uncover those hidden gems.
Find those hidden gems.
And stay ahead of any changes.
Just stay informed.
Yeah. And remember, Buckalew Financial Services.
They're there to help.
They can really help you through all of this.
Absolutely.
Taking charge of your Medicare benefits
can
lead to better health.
Better health.
And financial well-being.
And financial peace of mind.
So here's a final thought for you.
All right.
What aspect of your Medicare benefits are you going to prioritize exploring further?
Yeah, what are you going to do?
Maybe it's those fitness programs.
Could be.
Maybe it's finally understanding those prescription cost savings options.
Lots of options.
Whatever it is.
Yeah.
Take the time to learn.
That's right.
Advocate for your health.
It's your health.
That's it for this deep dive.
That's all for today.
We'll see you next time.
See you next time.
Bye.